A groundbreaking study at Northern Ireland's University of Ulster points towards new possibilities for saving millions of pounds in healthcare budgets worldwide and radically improving quality of life for patients. And it's all down to something as simple as providing proper seating. The study focused on long-term residents of care homes, people who spend up to 12 hours a day sitting, and who are the group most at risk of developing pressure ulcers. But there's every indication the startling results here will be replicated with any patient who has to spend long hours seated.
There really are very dramatic results, and we are really amazed at how big the results are.
In a time of straitened financial circumstances for the NHS, it could be a very dramatic effect, yes.
We're not suffering the same pain, we're not having to give the same pain relief that we would have maybe given in the past, and that has to be a benefit.
It's been amazing over the last 12 weeks to see the difference that we've been able to make.
We are really pleased with the results. We're very pleased for the participants who took part in the study.
In her work as an occupational therapist, Martina Tierney could see that seating had failed to keep pace with other medical advances. Daily, she witnessed the disastrous impact of poor seating. That's what prompted her to do something about it and start her own company, Seating Matters.
The more I learned about seating, the more I realised that we do it so badly. And even as a professional group, we don't know enough about it. And we underestimate the impact that good sitting has on a person's well-being. When you work with people with long-term disabilities, and we would, as an occupational therapist, should have a caseload of people who you would visit on a regular basis, and you could see their deterioration in their condition. Posture can kill. You'll never see it written on a death certificate, cause of death, posture. If someone has been in poor posture for the years and months leading up to their death, it has impacted their breathing, so therefore they could have recurrent lung infections. It's impacted their ability to go to the toilet, so therefore they can have recurrent kidney infections. It's impacted their ability to swallow, so therefore they stop eating. That's where posture can kill. I look at those people and I think, if that was me, if that was my mother, I would not want them sitting in that chair.
In 2000, Martina and her husband, who's an engineer, decided they'd bring seating into the 21st century, designing and making their own chairs. Chairs which are now at the cutting edge of seating technology and are used in healthcare environments around the world. Therapists and healthcare professionals could see how the Seating Matters chairs were quickly bringing radical improvements to patient comfort, health and overall quality of life. So to back up these observations with hard evidence and data, Seating Matters partnered with the University of Ulster to conduct a rigorous 2-year research project quantifying the impact of proper seating and its potential financial benefit to the healthcare system. The study examined 2 groups of clients in a number of typical care home settings. The control group would stay in their existing standard chairs. The intervention group received individualised seating assessments, and then new Seating Matters chairs specifically chosen and adjusted to suit them.
Using these lateral pads in at her chest.
The question was, would the evidence from the clinical data show that proper seating would make a real and lasting impact on the cost of care and the quality of life and health of these residents? Jackie Casey is a lecturer in occupational therapy at the University's School of Health Sciences. An expert on seating, she was one of those charged with overseeing the study.
We're really, really pleased with the results within a short period of time. I was initially a bit apprehensive about 12 weeks being quite short to measure some of the changes, because we were thinking about contractures and prevention of pressure ulcers. The results within those 12 weeks of doing the trial have already started to show some really, really positive outcomes.
You've come up with techniques that work for you and get nice results.
As the university's lead in academic enterprise, Dr. Suzanne Martin's work brings her into contact with all sorts of cutting-edge advances in health sciences. But no other study has shown such dramatic results as quickly as the Seating Matters clinical trial.
We are really pleased with the results. We're very pleased For the participants who took part in the study, we could see a difference in their facial expressions, we could see a difference in their posture. Family members told us how wonderful it was for their loved ones to be in the chairs.
Olivia McVeigh is one of the occupational therapists who worked with clients throughout the clinical trial.
There was one gentleman in particular who slid down the chair every single day, and he spent most of his day at the bottom of the chair or almost on the floor, and there were a few times around him and he was lying on the floor. This man couldn't communicate for himself. He couldn't tell me how much pain he was in, but you don't have to hear the words to know that he was in pain and discomfort and total distress. And there's no reason that at somebody's later stages in life they have to have their dignity and that wiped from them. So what we did for him, when we sat him comfortably in the chair, you could just visually see the change. His whole demeanour, his whole attitude was changed. He was relaxed, he was safe, and he was just so much more happier. And even the carers and nurses and everybody noted it, and they were happy because he was happy, and it makes everybody's job and everybody's life so much more satisfying.
Another lady was actually now able to take her hand away and she can reach for her cup of tea, and she's self-feeding, so she will now feed herself her own meals as well as take her own cup of tea, which she couldn't do before because she was trying to stabilise herself and she was very uncomfortable and very insecure in her chair. So that's the big improvement.
We have another lady that we are actually working with at the moment, and she was quite distressed because she was in a lot of pain when she sat out in the chair. So before she would get out to sit, she would take paracetamol to sit out, and she'd take paracetamol at regular times during the day just for pain. And then she started that she wouldn't get out of bed because the pain and the discomfort in sitting was too great. So we did an assessment and we put her in the Atlanta chair, which is very, very comfortable. And what we noted over the next period of few weeks is that she didn't take any paracetamol. The discomfort had left, the pain had left, and she was able to sit out in her chair for most of the day without taking paracetamol. So that was a big plus for her.
Clients were smiling. There was a lady who was actually able to call hello, which she hadn't been able to do before.
In addition to the uplifting human stories, the study also showed some remarkable statistics, confirming how correct seating could dramatically reduce the cost of care. Treating pressure ulcers costs between £2 and £3 billion a year in the UK alone. They cause immense suffering and pain to patients, they're notoriously difficult to treat, and they'll ultimately take the lives of 60% of patients suffering from them. At the outset, close to half the study participants had grade 1 pressure ulcers, otherwise known as non-blanchable skin redness. Over 12 weeks, the control group showed an increase in pressure ulcers of 5%. However, those using the Seating Matters chairs had better posture, improved loading of the body, and more effective repositioning. And the incidence of pressure ulcers dropped by 88.3% in this group.
Skin redness is potentially a grade 1 pressure ulcer. So we've been able to show a reduction in skin redness for the intervention group, the clients that we positioned in a chair that specifically met their needs. So they've definitely shown improvement. So that has reduced the risk by making sure that they're positioned properly, they're weight bearing through the right parts of their body, and also that the cushion itself that's in the chair gives some pressure redistribution properties as well. We've been able to show that the risk has been reduced, which is great.
Dr. Mark Bailey is an economist at the University of Ulster. He's been analysing the clinical trial data from a financial perspective. The figures make it startlingly clear that massive amounts of money could be saved if Seating Matters chairs were used and the results replicated in all nursing homes and hospitals.
The numbers we've seen in the study do seem very dramatic in terms of, I could say, over an 80% reduction in cost. That is dramatic, those big numbers. Pressure ulcers typically occur in something like 20% of all NHS or nursing home patients. In terms of a cost, that's ballpark £2.5 billion a year for the UK NHS, around about £150 million a year for UK nursing homes. So it's a fairly substantial sum of money. We're estimating somewhere in the region of 80% reduction for the NHS, slightly smaller for UK nursing homes, but there's also the non-monetary effects like people's improved quality of life. We're not doing any sort of quality adjusted life analysis here. We're just talking about purely and simply financial cost benefits. If you're looking at it from the accounting side of things, a payback, it's a very, very substantial payback.
Researchers were also surprised at how the new seating helped increase oxygen levels in the participants' blood. 95% of those with new personalised seating benefited from an increased oxygen level. Of those who stayed in their existing chairs, 45% suffered a deterioration.
The pulse oximeters that we put on showed a huge change for clients. They had better oxygen saturation levels on the whole in the intervention group. So people who were now positioned properly, so they were more upright. Their lungs, they were able to breathe more comfortably. Their tissues, we believe that the blood vessels probably weren't as occluded. There wasn't as much pressure being put in areas where we would be concerned about the oxygen getting through. The blood, as it circulates, brings oxygen and nutrition to the tissue, and we need that to prevent skin breakdown or to help heal. So we can show that the oxygen saturation levels are much higher. It's a huge percentage in the intervention group. We weren't expecting it to improve so much and so drastically.
But also from Martina's point of view, it has been wonderful to provide her with real concrete evidence of things that she always felt were right, things that she thought in her heart of hearts, and that was her motivation to provide seating in the first instance.
And it doesn't matter what country we go to, we encounter the same problems. And I have a real passion to educate people, occupational therapists, nurses, families, on the importance of seating and on the impact that poor seating can have on their family and on their friends. They're having a major impact on a person's quality of life. They're helping to reduce pressure ulcers, and they're actually improving the happiness of the person, sometimes at the very end stage of their life.